So I'm really so delighted to have our closing speaker, Dr. Sara Bleich. She's just a terrific scientist, terrific champion, a terrific policy leader in this space. So she holds a PhD in health policy from Harvard and a bachelor's degree in psychology from Columbia University. And so that's actually kind of perfect for food, combining psychology and health policy. She served in the Obama administration as a White House fellow, where she advised the USDA as a senior policy advisor. She came back to Harvard School of Public Health and was doing cutting edge research and really pushing forward the field around food, nutrition equity. And then in the Biden administration, she was tapped to go to USDA, and she's now the inaugural Director of Nutrition Security and Health Equity at USDA. And so thank you so much, Sara, for coming to speak with us. Looking forward to your talk.
Thank you. Well, it's great to be here, and I feel like I drew the short straw because I arrived at 3, which means that I missed lunch. And I also have to follow this amazing panel of women, but very nice to be here. And I give a lot of public remarks. This is the first time I'm in a room with people in 3D, so it's very nice to be here with all of you. And to those of you that are virtually out there, it's very nice to see you as well. So how I want to round out this summit is to talk a little bit about the work that we're doing at USDA. We've had a big push in the last several months focused on nutrition security, and a lot of that work has come out of this institution. So I want to say a bit more about how we're defining it, why it's important, and some of the key actions that we're taking. And since David is asking y'all to raise your hands, I want to know how many of you all saw the Secretary of USDA, so Secretary Vilsack, saw his address middle of last month around nutrition security in New York. Okay, so we'll send the links around so that everyone can raise their hands the next time you're asked. But basically what I want to do is amplify much of what he said, which is what is nutrition security, why it matters to us, and why we're focused on it. So first place I want to start is around definitions. And one of the things that has become really clear is that nutrition security, which really got elevated by the viewpoint that Dean Mozaffarian did in JAMA about a year ago, what's become clear is that when you ask people what it means, you hear many different things. You might get 10 answers from 10 different people. So March was National Nutrition Month, and one of the things that we really tried to do is over and over again repeat what we mean by nutrition security. And so the other piece that's really clear is that there's a lot of confusion about how it differs from food insecurity, which is another key metric that has been long measured by the government, particularly by USDA. So what is it? What is nutrition security? So specifically, and you probably heard this earlier today from Dean Mozaffarian, but specifically it means consistent access, availability, and affordability to foods and beverages that promote well-being and prevent disease, and in some cases treat disease. And particularly it's interested in focusing on racial ethnic communities, rural and remote populations, including tribal populations. And the key thing, and the key way it differs from food insecurity, is that it builds on food insecurity by, number one, recognizing that not everyone follows a diet that's health and that's has physical activity consistent with federal recommendations. And 2, by having a very strong focus on equity. So to put it most simply, when we speak about nutrition security from USDA, what we care about is consistent and equitable access to healthy, safe, and affordable food. The other term that's really important to have on everyone's radar is health equity. And that's referring to everyone having an equal opportunity to live the healthiest life possible, no matter who they are, where they live, and how much money they make. Now, in the last panel, you heard just a word or two about structural racism, and I want to foot stomp on that a little bit. So first off, if you look in the literature, there are a whole lot of definitions of structural racism floating around, and there's not one that's totally accepted by everyone. But the key point that I want to leave with you all is that when we think about structural racism, it is not talking about private prejudices that one person might hold. What it is talking about is systemic prejudices in institutions, in organizations, and in some cases in government that make it very hard for certain groups to move forward. And so confronting racism then requires that you transform these institutions and policies. So I want to take a second and be a little bit more concrete about what we mean by this. And you heard just for a second the last panel about one of the topics that I want to talk to you about. But big picture, if you think about structural racism, 3 of the main ways that it has been manifest as a legacy of slavery is 1, redlining and racialized residential segregation. The second is mass incarceration and police violence. And the third is unequal medical care. And I want to talk to you all about residential segregation and redlining. So first off, what is redlining? And what that refers to is discriminatory practices that made it hard for Black people to get home loans. So it made financial services out of reach. Now, that matters because, well, taking a step back for a second, what we know is that these practices ended decades ago with the Fair Housing Act of 1968. But the problem is that the issues around redlining is still seen today within residential segregation. And that has formed a platform for broad social disinvestment. And that has presented in things like lack of green space, lack of healthy stores, lack of schools, and the list goes on and on and on. So I want to leave you with two top lines from this slide. The first is that structural racism is real. It impacts people in meaningful ways, and it stretches across our institutions and our economy. And the second is that structural racism harms health in ways that can be described and measured. And this is where nutrition security comes in. This is where all of you can make a difference, and this is why USDA is leaning in so hard on this. Now, many of you, either in the virtual room or in this room, have probably worked in the food space for a long time. In the last panel, folks have been working in the food space for at least a decade, if not more. And so you might be wondering, well, why is USDA leaning in now? And the answer lies in the pandemic and the administration's goal, meaning President Biden's goal, to advance racial equity. And so what we know is that COVID brought health disparities and the vital need for healthy food up to the forefront. And so there was one study, which the secretary highlighted last month when he was speaking in New York, which showed that 2/3 of COVID hospitalizations were due to 4 diet-related conditions: obesity, diabetes, hypertension, and heart failure. And disparities in diet-related diseases are associated with decades of structural limitations. And you can see that in healthier foods. You can see that in historic inequities. And you can just look at these slides and see the black-white differences in household income, unemployment, life expectancy, and the list goes on and on. And we also know that households with children are particularly bearing the brunt of challenges when it comes to not having enough resources to afford healthy food. So what are we doing at USDA? So USDA, again, this is a core priority leaning on nutrition security. Secretary Vilsack has identified 5 priorities for this administration. One of them is nutrition security. And to meet this challenge, we are leveraging all of our assets to try to push those towards this effort. And so what are those key assets? First and foremost are our nutrition assistance programs. Those, if you're not familiar with them, they reach tens of millions of Americans, including about 30 million school children each day, nearly every other baby that's born in the United States. It is also the case that we are in about 99,000 schools through the school meal program, and we are also administering benefits that are serviced by about 250,000 retail outlets around the country, supermarkets, convenience stores, and otherwise. The second is our nutrition education and promotion efforts, which total about $1 billion per year. Within the Food Nutrition Service, which is the part of USDA that I'm really focused on today, that's SNAP Education, so the Supplemental Nutrition Assistance Program, which services about 43 million Americans per month, and that's WIC Nutrition Counseling. The third thing is by translating the dietary guidelines for Americans and doing a lot of research that supports that. You might have seen today that the kickoff for the next round of the dietary guidelines for 2025-2030 was launched today with the questions being posted for public comment. It would encourage all of you to offer public comments if you have them. And then the fourth is that if you know USDA, you know that it is an extremely diverse place. And so there are many, many equities at the department that extend far beyond food and nutrition that are being leveraged as part of this effort. So one of the things that the secretary has identified is the organization of this work across 4 pillars. So there's meaningful support, providing nutrition throughout all life stages, healthy food, connecting Americans with healthy, safe, affordable food sources, collaborative action, developing, translating, and enacting nutrition science through partnership, and then prioritizing equity every step of the way. I cannot foot stomp hard enough on the fact that this administration is not just saying it cares about equity. From where I sit, it truly cares about equity, and that starts from the president, and it certainly has come on down through USDA and through the whole federal family. So for each of these pillars, there are subcomponents within them. I'm not going to go through these in any level of detail, but for each of them, I just want to highlight one thing. And so for this one, what I want to highlight is a really big change that happened last fall, which is updating the SNAP benefit. So SNAP is, again, the Supplemental Nutrition Assistance Program, helps about 43 million Americans afford food each month. And what happened is that there's something called the Thrifty Food Plan, which is how you calculate the SNAP benefit. That had not been updated in about 45 years. And so what happened is That was reevaluated, and the average benefit went up by 21% per month. That is really significant. And what it has done is it's put healthy food within reach for many families who didn't have that benefit. I do also want to say that one of the reasons why it has been such a professional pleasure for me to work on these programs, particularly SNAP, is because I was a SNAP baby. My parents got what was then called food stamps when I was a kid. I was also a WIC baby and school meals. These programs impact lives. And we are at a moment right now where from the president on down, there's a huge focus in how do we take these powerful tools and make them even more powerful. So the next area is healthy food. And one example here that I wanted to just briefly touch on is actually consistent with some of the work that's happening here at Tufts, which is focusing on testing and evaluating the use of telehealth innovations in the delivery of WIC. And recently there was a request for applications around the WIC Farmers Market Nutrition Program. And then for collaborative action, one key thing to hold up here is the MyPlate Strategic Partnership, which does a great job in pushing out the messages around MyPlate. And again, with the new iteration of the dietary guidelines that's coming, it's really important to get these consumer-friendly messages out that are the translation of the dietary guidelines in front of people so they can make healthier decisions. And then finally, around equitable systems, one thing that I do want to stress here is SNAP education. SNAP has tens of thousands of partnerships around the country, and this does two things. One is it helps have meaningful impacts on local policies, but two is that it is reaching people all throughout communities. If these programs are at a very high level, they're going to have clear blind spots. But if you can drill down and partner with hyper-local parts of communities, it makes it possible to reach pockets who are often left behind. And so SNAP-Ed plays a really important role there. In terms of this whole approach to nutrition security, we've identified two key phases. The first was kicked off last month during National Nutrition Month, and it was bifurcated. So the first part of the month was, what is nutrition security? How do we get the message out? And we will continue doing that over and over and over again. But we are also really trying to push on and help people understand what are the key equities that USDA brings to bear? And then as a next step, what are some of the key equities in the federal family? Our goal is to carefully delineate our lane, because the reality is, yes, USDA is putting tens of billions of dollars toward this effort and has done so for a long time. But the problem of diet-related diseases and disparities is way bigger than USDA could ever solve, or even the entire federal family. And so it's important to think about, how do we partner? How do we collaborate? How do we figure out ways to find synergies to push this work forward? And this is where a group like this becomes so important, because you're so well connected with the community, because you understand the needs in the groups that you serve. And it can be simple things like, if you look at WIC, for example, about half of people who are eligible to participate are not in the program. So how do we help people? And there's a lot of work happening on the federal level, but that's an area where local efforts can really make a difference. Do want to say that we have a whole lot of stuff underway to try to push in this area. We'll emphasize just two here. One is that we are updating the WIC food package, and then the second is that we're updating school meal standards. And I mentioned the dietary guidelines. So let me wrap up with just three takeaways. The first is that from where I sit, and I've been working like many of you in this space for a long time, but it really feels like now is the time to lean in when it comes to nutrition security, and that's in part because food insecurity is high. Diet-related diseases are rising, largely due to COVID, and there's a huge disproportionate impact on historically underserved populations. The second is that healthcare and food tech and foodpreneurs, I love that term, play an essential role. As I mentioned, USDA will not solve this problem on its own, nor is it designed to do that. This needs to be a whole of country and obviously whole of government approach. So I want to stop, but before I do, just want to say that there are folks in this room who I have reached out to in the past year for advice and to litmus test different things, so I just want to say thank you, and would welcome opportunities to talk more about this topic, and would welcome any questions in the last few minutes. Thanks.
Perfect. Thank you so much, Sara.